Hi, welcome back to another episode of Mombie's Trying to Help. I'm April, otherwise known as the Sci-Fi Mombie. Um, and thank you for watching my content, especially this show, because this one is really outside of my comfort zone because of my daytime career. Um, my career. The podcast is a hobby for now, but we're getting there. We're getting to monetization. So, um, so the first episode I kind of just went over some general basics about health insurance, and that is my career. um, so I wanted to delve more into each topic um, of your health insurance. We're going to cover benefits, we're going to cover notification authorizations, we're going to cover networks, we're going to cover the revenue cycle, you know and I'm going to show you some of the things. I'm going to show you coding. I think you deserve to know. It's not a secret. None of it's a secret. Okay? Um and that's why I think there's such a disconnect in society and why the healthcare system is broken, because people aren't told things. Um like balance billing. No, don't do that. Um and I'm going to I can't do too much. All I can do is hand you the knowledge, and then you have to advocate for yourself. Because knowledge is power, as we've learned in Schoolhouse Rock, and you have to take up the fight. You can win the war, battle by battle. It may take a while. It's not going to happen overnight. If we all do it together, we can make huge changes. So today I'm going to talk to you about benefits. Okay. Now, what are benefits? Well, it's in the healthcare field. It's a section of a certain type of healthcare that would be covered under your plan. Okay. So, who builds your benefits? A lot of people are under the impression that it's solely the insurance company. No, no. If you are employed, you are considered employer and individual coverage. If you are on Medicaid, you are considered community and state. If you are on Medicare and a supplement, or Medicare Part C, which is A, B, which is hospital, physician, and your drug plan, which is D, your federal government. If you're on TRICARE, your community and state, and that's government insurance. That's the military insurance. There is another subsection of insurance, and it's called, my mind just went like totally blank. That's just the story of my life. Metashare. And Metashare is not technically insurance. What it is it's a co-op of people who get together, mostly religious organizations, that refuse to buy into the normal healthcare system, and all the members crowdsource together into a pot, and then the claims get paid. The only problem with that is, this is so bad, there are claims that don't get paid for years. I mean, years. When I left my last employer, we had claims that were sitting on the books for 10 years, and the people had to make small payments to pay off their health insurance, their health claims. It's not a great insurance at all. It's not an insurance. It's a co-op. So, and it's legal. It's absolutely legal. All right, so there's an explanation of, and I'm going to, when I get to Medicare, Medicaid, because I'm going to walk through all those in this series. I think you all deserve to know. Um, you know, I'll discuss Medicare C, Medicare D, A, B. I'm going to discuss Medicare supplements. Now, I'm not an insurance agent. I refuse to be an insurance agent, okay? I'm a certified coder. But I've had to learn all this stuff as I go along because there are certain rules and regulations that you have to follow if you want to file medical claims. So you have to know, okay, so most of the time, coders don't like, I mean, I have to take that back for a second. Coders have to know, should know reimbursement policy with each insurance company. And most of the times, employers will assign an insurance to a coder so that, they aren't overwhelmed with trying to learn all 50 bajillion insurance companies' reimbursement policies or medical policies. It's just how it works. Your employer or the government sets or states. You got to remember with Medicaid, Medicaid is operated by the states. So the state sets the benefits based on CMS or Centers for Medicare Services guidelines. Okay. And actually, all insurance companies have to follow Medicare guidelines. It's federal law. No matter how much each insurance company wants to fight it, they have to. So let's talk benefits. Okay. Normally, there are like certain basics that are covered on an insurance plan. Preventative office visits, regular office visits, specialty office visits, durable medical equipment or DME, and certain types of therapy. And childbirth and inpatient stay. Those are like the most basic ones. Some employer groups can add medical weight loss, acupuncture, infertility, men's health issues, cancer. Cancer is a common one, but sometimes the benefits are limited. They're limited. Vision, dental, oral surgery. There can also be exclusions. TMJ, which is, you have problems with this joint right here. Certain types of durable medical equipment are excluded. Any procedure that is deemed by Medicare to be not medically necessary. So I'm going to show you my benefits. I'm going to black out a lot of things, but I'm going to show you a basic rundown of what I have on the employer and individual side of my company. Now, this is mine. I'm not going to show you the group number. I'm not going to show you the name of my company. I'm not going to, But I just want to show you some of the things that we, might be in a typical benefit package on a health insurance plan. Medicare annually puts out a book. I'm not kidding. I think I have one lying around here somewhere. I'll show you. It's an old one, but it details all the policies, what your benefits are, what's not covered, how you file a claim. I mean, even how you file a claim yourself to Medicare. And for Medicare and Medicaid, all of that information is online at cms.gov. cms.gov if you're on either one of those plans. So this is the screen that shows the basic out-of-pockets for your in and out-of-network, as well as your family and individual. It's really good to get acquainted with these numbers because it makes a huge difference if you hit your out-of-pocket for the year. Hitting your out-of-pocket for the year and your deductible means that any health services above those lines are paid for in full. This is the opening screen to my medical benefits. I have 2 dependents on the policy with me. We have preventive, emergency care, office visits, hospital visits, and physical therapies. It's really important that you walk through each one and get acquainted with the subsections of what benefit applies and how you will be responsible for a portion or your out-of-pocket expense audit. So I went further into the preventive care, and I have benefits for an annual visit, preventive screenings, which is like breast cancer, cervical cancer, colorectal cancer, high blood pressure, and some other services under preventive. And it's really important that when you're in the doctor's office, you say, "Hi, I'm here for my preventive. Here's what my insurance says they'll pay. So let's just talk about that." So I clicked further into annual visit, and it tells me that I have to use an in-network physician. There is no out-of-pocket expense. The annual deductible does not apply. I don't need to get pre-authorization. And the doctor doesn't need to get pre-authorization. But if I go out of network, I have to pay a 50% coinsurance. So that means I will be paying half. And if my out-of-network deductible is not met, I will be paying for that too. And as usual, there are limits and exceptions. But otherwise, preventive in-network annual physicals are free, as my employer group stated. So I went into my emergency care benefit. So I have urgent care services, an emergency room, and I also have 24/7 virtual visits. After COVID, these benefits are readily available on most plans. So you want to check with that. But for me to be seen in any one of these facilities, I have to pay a 20% coinsurance after I meet my deductible. So, got to watch out for that language of your deductible, because that's really important to meet that so that your claims will at least get a certain portion paid out of, from the out of pocket. The coinsurance. This is hospital visits. So I do have inpatient maternity care and outpatient surgery benefits. There were a couple others, but I didn't scroll down very far. Of course, gotta pay your deductible. And then you're responsible for 20% coinsurance. Now, on inpatient hospital, the doctor is responsible for getting an authorization or notification. And actually on this category alone is where most of the notification authorizations have to be done, per the benefit that your employer sets. So say you're going in to have your gallbladder removed. Most of the time those are outpatient surgeries now, unless you have like extreme bad circumstances. So if you go to an in-network facility, they ask the doctor, the doctor to have a notification on file so that they can complete the gallbladder surgery. And that will push your claim through to get paid. Now, tricky part is making sure, like, say the doctor goes in to, take care of your gallbladder and it becomes a whole different surgery because he found something that needed to be taken care of. Well, that would change the procedure code. So there are circumstances like that where, you can look through the CPT-4 book and, gallbladder, you know what I'm saying? Most places will authorize all those codes. The last section of benefit I'm showing you here is for physical therapies. My plan has chiropractic and then other types of physical therapies. Like, I know we have occupational therapy where, they work with you on how to adjust to, certain things in life, and then physical therapy to, strengthen you up, because we had to use it last year for Vic when he fell and broke his leg. But it's always so important to look all this over and read the language. I know sometimes the language is hard and it looks like stereo instructions. I get it. But it's so important that you grasp the knowledge. So if I need to go to the chiropractor, which I don't, every visit, I have to pay my deductible first to an in-network provider, and then I'm responsible after the deductible is met for 20% co-insurance. So that's 20% of the allowable that the contracted provider has agreed to with the insurance company. They signed a contract on it. So the provider's going to have a certain amount that they write off per their contract with the insurance company. You will never, ever pay that unless you go out of network. But when you're in network, you're going to pay 20% of the contracted allowable. So let's say your doctor bills a $250 physical therapy visit, but they're only reimbursed from the health insurance company, let's say $150. So your co-insurance amount, because it's 20% of $150, would be $30 that you would pay to the doctor's office. Okay, this is my insurance card and it's like really, really crappy. So I apologize, but I had to do it to take a lot of the stuff off of it because I have to, protect my stuff, and, identity theft is rampant right now. So, it will have the logo and the name of your insurance company. It will have your policy number, your group number, the names of the dependents that are covered, what kind of plan you're on. It will have your in and out of network deductible and co-insurance. It will have, in the box in the right hand corner, it will have your pharmacy benefits. That could be on the front or the back, but for mine it's on the front. And then it tells you they administer your insurance company the plan. On the back of your card, it will give certain information of how to contact the insurance company. So the first one that's normally there is the claims filing address. Then it will have important numbers like how to contact customer service, how to contact mental health customer service, because sometimes those are separate entities, how to contact your pharmacy division. Like for me, I have a healthcare advisor, so that's a different number to call. Now, I blanked out a lot of this so that, it's protected. But there's other things on here, like there's a barcode. Like mine has a barcode that providers can scan if they, have the necessary equipment to pull in all my data off of my policy to help them register me in the provider system. It's really important that you get to know your insurance card and make sure you have up-to-date copies. So, there's a little bit about benefits. Just to reiterate, and you can do this. It's always great to keep the number for your insurance company in your phone, especially when you need to call and find out, information of, is my surgery going to be covered? Is my procedure going to be covered? Is my son's therapy going to be covered? You know, um, you can also ask them, are you sure the claim is calculated right? Are you sure the system processed the claim at the right benefit level? Some plans have tiers of provider, um, because some providers will sign on to a higher level where they get a higher reimbursement rate. And they get, like, also with the tier system per benefits, um, a lot of health insurance companies, that's how they get you the information for the provider. So those tier one providers are going to have, the first visibility when you're looking for a new provider first. So just pay attention to those things and make sure you have an up-to-date insurance card with you at all times, because in the case of my company, they don't always print them for us every year. But I order one just to have it in my wallet in case something, like, you never know when an accident or something weird's going to happen and they need to see your medical information. So, but if you have any questions, reach out to me at questions@sci-fi mombie.com. I will try to help you the best I can. Like I said, I have to be careful. I don't want to lead you astray. I don't want to give you misquoted benefits. That's where I will always refer you to your insurance company or to your provider's office. You have the right to tell your provider's office, hey, I want you to do a quote of benefits for me. They're mandated to do it if they are contracted with your insurance company. Because sometimes, and it happens, people are human. There's a misquoted benefits, and it's the difference between your claim being denied and you having to pay for it, or the insurance company pays the provider, saving you money. And as we all know, you already pay enough in insurance premiums. Why would you miss out on free money? It's your money. Like the J.G. Wentworth people, it's your money, use it when you need it. Exactly. That's what health insurance is. That's why we take it out every year. That's why I have to be careful what I say next. But there's a lot of things that are on your policy. Like, I was just scrolling through mine. I mean, I've got a workout thing, and I've already went through like the medical weight loss, and we have a company called Real Appeal that sends you swag and helps you with exercise and eating, and there's added benefit you're paying for. Use them. If your company has a wellness program as a part of your benefits, use it. We have one at my company. Now, I'm a slacker and I haven't been taking advantage of it like I should be, but I have in the past. Yeah, this next year I'm changing a lot, because now the kids, they added the benefit to where my dependents can be in the wellness program. So I will get even more money back on my paycheck. Yeah. So check into that. It's always a good thing. My employer even went and got, some like spin companies to give us free or discounted memberships in their cycling spin, world on, equipment and classes. And, you never know until you start digging around. And that's the key to all of this as I go through this series is knowledge is power. Find out the info, research it, get logged in and sign up for your insurance company's portal. That's where I just got my benefits to show you from. And most of all, don't give up. You can win this war. It's your money. You pay a lot in premiums every year, you know. While you still may have to pay deductible and out of pocket, make the insurance company work for you. Now I'm afraid that I said that because I do it too. I do it to my own, you know. Um, it's it's a confusing industry. It's a frustrating industry. Um, I was hired on during the branching out of the ACA or Obamacare. Um, thank God I've got to keep my job because a lot of insurance companies have left the markets. It just wasn't what they were told. You know what I mean? But still go out there to healthcare.gov and look around because sometimes, especially if you're like a contracted employee or freelance, you don't get insurance through who you're working for. So you have to go. So it's always worth it. Make it work for you. You pay a lot of money for it. It's vitally important because in times of crunch, like you have a heart attack or you have a stroke or there's a car accident and subrogation is where the car insurance companies are working with each other to pay for your injuries and pain and suffering and all that. And if that's ran out, your health insurance takes over. Make it work for you. All right. Like I said, if you have any questions, I will try to help you. I can't file an appeal for you. I can't call the insurance company for you. I want to be careful because I don't want to give you a misquote of benefits. But I don't mind talking. I just want you all to gain the knowledge, and you have to do the research. It's not going to come. It's not going to be handed to you. It just doesn't work that way. All right, guys. I hope you have a great day. Later, party people.